This is Group 9's video presentation for Public Affairs 311, titled Government Challenges in Innovation Implementation. Innovation can be exciting yet challenging due to many factors such as funding and support. Our project looks at 4 cases in different countries and the struggles they shared in implementing new innovations and how they overcame them.
First, we identified 6 elements that were key to innovation. These 6 elements include a gap analysis, which is to determine if something's performing as well as planned. Second, data collection, the methods of how a government finds out if there is a problem. Data interpretation, which is using the data collected to pinpoint the exact problem and create solutions. And fourth would be checking and interpreting data to see if it supports proposed changes. And lastly, to present the data to public in an easy, accessible way and that people can understand, using the data and feedback from the public to create and make changes. Our first case comes from a national park in Greece. The park began to attract less and less visitors, which in turn hurt the local economy. Park authorities surveyed visitors to see what they didn't like about the park. The data showed that old trails were worn out, boring, and certain facilities such as the benches and restrooms were outdated. Using this information, the park authorities made new paths, updated the facilities, and even changed the main roads in and out of the park. These changes were enough to turn the park into the #1 tourist attraction in the area.
In the case of diabetes self-management program in the United States, we see how the program noticed a lack of available resources and doctors for the management of type 2 diabetes. The program collected data by evaluating participants' health progress and used the data to make important changes in the program to further benefit them. These changes ensured even better patient success for new patients, which upped the numbers and got the program more funding and resources.
The government in India struggled with a population of over 1 billion people and no form of national identity system. The lack of the system meant some people in remote regions of the country lacked access to certain government aid programs. The government decided to implement the hard card, which would use biometrics of a 12-digit number, much like a social security card in the U.S. This allowed them to cut down on people abusing the system while at the same time reaching people that had previously not had access before.
Okay. In the United Kingdom, the Family Nurse Partnership Program was implemented in response to a rising rate in teen pregnancies. Specialized nurses were provided in home care to expecting young parents so they were better prepared for a healthy child and life after delivery. The program's success compared the health and success of participants and their babies against the trends seen before the program came about. Results showed participants were better prepared and better able to care for their babies, which resulted in the overall better health of both parents and children alike.
In conclusion, we see how each of the governments in these 4 cases identified a problem and innovated solutions to remedy them. Sometimes the solutions are simple, and other times they are much more complex. Minor tweaks can sometimes mean major improvements. No matter what, though, governments have a responsibility to the people to listen to and address their concerns. It's important to not just fix a problem, but to try to innovate ways to keep the problem from ever happening again. Government should do this in a timely and cost-efficient manner. By doing this, they can set themselves apart from other governments and launch themselves into the future as pioneers for other governments to emulate.